From midnight, 1 minute before midnight, tomorrow night, on Wednesday, everyone must stay at home unless they're working in essential services, and Paul will talk more about that a little bit later. This means that people must stop interactions with others outside of their households. Self-isolation is a very effective way to help protect all of us, our families, whānau, friends. You must spend time just with those with whom you are in self-isolation, and keep your distance from everyone else at all times if this is to work, and we must make it work. You can still go outside, go for a walk, exercise, take your children outside, but keep 2 metres away from others at all times. You may recollect yesterday I spoke of the need to have physical separation but to maintain social connection. Over the next 4 weeks, that's going to be very important, whether that be over the phone, over the fence, but always 2 metres apart. Food will always be available. You can continue to go to the supermarket or to a pharmacy and so forth. But again, keep your distance from others. And if you are coughing, sneezing and spluttering, please do not get anywhere near anybody else. We absolutely need everyone across society to observe these requirements so that we can protect New Zealanders and slow down this disease.
So there are 40 new confirmed cases of COVID-19 in New Zealand as at 10 o'clock this morning. We also have 3 new probable cases. In these cases, this is a person who has returned a negative laboratory test result, but the clinician looking after the person has diagnosed them as a probable case due to their exposure history and their clinical symptoms. These cases are actually treated as if they were a positive laboratory confirmed case, and the actions taken are the same as for confirmed cases, that is, self-isolation and active contact tracing. So therefore, our combined total of confirmed and probable cases is 155. And we will now report the total combined confirmed and probable cases each day. More details of the new cases, including the probable cases, will be provided via our website, that is the Ministry of Health website, shortly, and updated as new details emerge. There are 12 cases that we can confirm are recovered. We will be updating this number also on a daily basis. Our laboratories across the country are working to process and report all test results as quickly as possible. Anyone who has been tested is expected to be in strict self-isolation until advised of the result of their test. So far, we have information on around 1/3 of the new cases that I'm reporting today, and all of those that we have information on have a link to overseas travel. This may include being in the same household as someone who has travelled back from overseas, or they have been at a known event where transmission was occurring, for example, the Hereford Cattle Conference in Queenstown earlier this month, or they are close contacts of an already confirmed case. So recent travel from overseas is still the main driver of our new infections. Anybody who has recently travelled back from overseas should already be in strict self-isolation, no exceptions. Close household contacts should be particularly vigilant for any symptoms they may develop. At this point, we are classifying 4 cases as community transmission, 3 in Auckland and 1 in the Wairarapa. That is 2 more than yesterday, and in these cases we have been unable to confirm a definite link to overseas travel or to an existing confirmed case. Contact tracing is, of course, underway for all those cases. We continue to look carefully at all new cases as more information is reported by Public Health Services to identify evidence of community transmission. More than 900 laboratory tests were carried out yesterday, bringing the total number of completed tests to over 8,300. We continue to test people who need to be tested. As John has said, and as you will be well aware, we are preparing to move to alert level 4. There is a clear consensus amongst public health professionals, scientists, and a wide range of health professionals that it is better to do this sooner rather than later, and doing so gives New Zealand the best chance of breaking the chain of community transmission. This will require all our efforts, and I strongly urge all New Zealanders to play their part.
In the case, for example, of a child of an essential worker who cannot stay home and they need to have a child cared for, if they identify a trusted buddy, as long as they're not elderly or vulnerable in other ways, and if that person is identified as part of your self-isolated group, they become the child's caregiver. However, it is critical that that buddy cannot then have other contacts other than their own household. You all become one group, but it should be a tight group. The smaller the better. Another example could be helping a family with care for their disabled child to give the primary carers some time to rest. But again, you need to be identified as part of their self-isolated group, and you cannot have other contacts other than those in your own household. As the Prime Minister said, consistency is key, and making sure that we all have a very tight circle of care is needed to minimise any risk of spread. Again, the smaller the better. You'll appreciate our foremost priority since yesterday's announcement has been to make sure that all schools, kura, early learning services and tertiary institutions have been given all of the information that we have to keep them up to date. The Ministry will be working over the next few weeks to provide support for distance learning. We'll be pleased to connect with teachers interested in working with us, and we're sourcing devices and working through the logistics of getting them to students that need them. We're also working through issues where access to the internet is needed, and while this is a big and complex project, we are making progress.
The purpose of the Essential Services List is not to ensure that life goes on unchanged. It's to ensure that we are able as a nation to self-isolate and eradicate and eliminate COVID-19. The purpose is to ensure that we provide for the necessities of life, for health, for safety, for welfare, and for essential infrastructure. What that also means is that when we think about whether something is an essential service, there are two tests. Firstly, is it essential for those purposes? And secondly, how might it be delivered in such a way as to limit the risk of spread and transmission of COVID-19? To date, we have identified 15 sectors that are considered to be essential services. You can find those on covid19.gov.nz. We have allocated lead government agencies for each of those sectors who are working with those sectors, whether that is accommodation, whether that's transport and logistics, or whether it's utilities, to ensure that those essential services know who they are and know the steps that they need to take to provide for New Zealanders through the Alert Level 4. We will continue to update that website, and from 5 p.m. today, there will be an 0800 number where firms can call in if they are unclear about their essential services status. This is a principles-based regime. We won't be able to list every firm in the nation. My suggestion, however, is if that you're in doubt about whether you are an essential service, you're probably not. We will provide support. We will help you to identify if you are. We expect New Zealanders, firms, businesses and people to assist in the self-isolation process, not to assume that they are an essential service when in fact they are not. We will help you make those decisions. If we have helped you and you continue to provide services, we will help you further, and that'll be in the form of compliance and enforcement. As I've said, this is an evolving situation. We are working with firms today to identify the core essential services. We will update on the website, and we will have an 0800 number, and I look forward to your assistance in that.
Parliament will meet tomorrow afternoon. It will be a differently shaped session. It will start off with a debate similar to the one that was held on Tuesday last week, this time around the epidemic notice and any other documents which have been tabled by the government. There are likely to be very few members of Parliament present tomorrow. The Business Committee, which met this morning, has agreed to relax the proxy voting requirement, so no one who is not in Wellington will be required to attend Parliament. The Business Committee has agreed to recommend to the Parliament a special motion to set up a special select committee which will run for the next 4 or 5 weeks at least. It will be a committee that sits remotely. It will be chaired by the Leader of the Opposition or his nominee, and will have a majority of opposition members on it. The committee will have the unusual powers which generally reside with the Privileges Committee to send for people and to send for papers. As I indicated, it will only meet remotely. Members will not be in the same room at the time that it does meet. There will be a few tidy-up type arrangements done for the Parliament, a bit more time for ministers to answer questions. There will be a deferral of report back dates, and then there will be an adjournment motion and the agreed date to which Parliament will be adjourned will be the 28th of April, Tuesday the 28th of April. So the effect of this is that the 2 weeks which Parliament would be sitting, the next 2 weeks it would be sitting, and the following recess will all be rolled into one recess. At that stage, Parliament will adjourn and won't come back for nearly 5 weeks.